Good afternoon. My name is Andrea Sarralde. I'm the Community Engagement Reporter at Montgomery Community Media. Lessons learned from COVID-19 media coverage. This is the webinar we're hosting today, and the Healthcare Initiative Foundation supports this webinar, working to improve health and wellness outcomes for all who reside in Montgomery County, Maryland. Welcome to everyone. It is an honor to introduce you to our panelists. Meredith Cohn is a health journalist for the Baltimore Banner. She has been covering all aspects of health in Baltimore for more than 2 decades, including her work at the Baltimore Sun. She began her career at the Hagerstown Morning Herald and spent time as a business reporter at the Virginia Pilot and a congressional reporter at the State's News Service in Washington. Welcome, Meredith. Also with us today is Scott Maucione. He's the health journalist for WYPR. He studied journalism and politics science at the University of Maryland and got his master's from American University in applied politics. He has spent 9 years covering the military at Federal News Network and Inside Defense. His work has been published in the Washington Post and NPR. It's really an honor to spend this afternoon, this lunchtime with you, both of you, top journalists in the area. And we're going to talk about the coverage during COVID-19 times. We want to know what do you do, how you do it, and what we can learn from those moments. All of us journalists had tough moments covering, but also trying to do our job in a health crisis. So let's start with you, Meredith. Can you please share with all of us how you got into health journalism?
Oh, well, I guess many years ago, when the Affordable Care Act was being debated in Congress, the editors asked if I would start writing about the law, that it became a law, and never looked back. Covered all aspects of the Affordable Care Act, and then I think bird flu happened, and now all these years later, now we're 3 years into the coronavirus pandemic, and I'm still covering healthcare.
Yes, and the COVID pandemic seems like never ends. We're still covering many topics about the pandemic. And how about you, Scott? How you start your career?
Well, after college, I covered a lot of local issues, and then from there went on to cover the military. And the military is really its own government in itself, so it has a lot of health issues, including mental health and its own medical system. So I covered that, and then sort of took a logical step into really public health here at the NPR member station WYPR in Baltimore.
I'm sure for both of you, it was before and after the pandemic. I'm going to ask you both if you can share your experiences as a health reporter before and after COVID-19. Meredith.
I guess before the pandemic, I covered all aspects of healthcare, lots of research at the University of Maryland, at Johns Hopkins, other public health outbreaks, and then there was this mystery novel virus overseas, and then we started seeing cases, I think first in Illinois and then in California, and I was just sitting at my desk one day bracing for the news that it had come to Maryland, and that was March 2020, and I guess everything has been different since then. We've all not only covered this pandemic, but we've all lived this pandemic. I think most of us have been infected by now. We've all been through trying to get vaccines. We've seen family members and friends and coworkers infected. So it's kind of felt a little different than past health stories that weren't quite so hitting home as this one.
Meredith, were you scared with this pandemic? Because we had a mission as journalists and storytellers being out there. We have the responsibility to bring information to our community, but at the same time, we put ourselves in risk. What were your thoughts at that moment?
Right. I guess like everybody else, we got sent home. The newsroom closed. I was at the Baltimore Sun. We all got sent home with our laptops and our phones, and none of the hospitals or doctors' offices would let us in. So we did all of our reporting on Zoom and over the phone, and then it didn't feel quite so scary because we weren't really interacting. My daughter was sent home from school. She was doing Zoom school from home. The very first story I did go to cover was when they started handing out tests at the public libraries, and there was a big rush to go get the tests. And I went to cover that story in person. I was outside, I was masked, and I got COVID.
Okay. The very first time that you were trying to cover something, you got COVID.
Yes.
As I want to know, Scott, how about you? How your life changed, your career and your role as a journalist changed before and after COVID-19?
I think one of the biggest things about it was how much COVID influenced everything that we covered. So, before covering the military, there were many aspects of, what we covered, and health was only one of those. But as things progressed, COVID became a factor in every single part of it, that be that weapons acquisition, or how they're going to train the military, or how they're going to really respond to COVID. So just like Meredith, my first story was going into the Pentagon, and they had just moved some of the seats farther apart. We didn't really know what we were working with yet. This was maybe late February, early March. And so, after that, really everything closed down in terms of going out publicly. However, the military was needed to respond to these situations. And so we had to pivot very quickly to working through phone and email, and really flexing our Rolodexes of sources that we knew, and building new ones in ways that were very unorthodox than we were used to. So, I would make a lot of telephone introductions, set up Zoom introductions, and really hope for the best in terms of making an impression. And I do have to say, one of the things I learned over that time is making yourself take breaks between Zoom interviews and telephone calls, because we had this kind of built-in time before to sit in our car and drive to the next spot and maybe decompress from where we were. And having a Zoom conversation over and over again really does take a little bit of your mental capacity away. So that was, I think, one of the lessons I definitely learned in this, not necessarily from the disease itself, but from the repercussions of feeling the pandemic and the cloisteredness of it.
I also remember that, years before, doing a Zoom interview was something that nobody thought about it. Like, it was no quality TV quality. It was kind of, and nobody expected that. Now is pretty much the norm. And we do a lot of Zoom interviews, and viewers are okay with that. And the most important thing right now is content. And we have improved, and we have learned, I think, due to a lot of technology aspects of doing a Zoom interview. So there's things that we have learned, of course, being a journalist during the pandemic. Meredith, how you localize your national stories, how you bring national stories into something local that matters to our community?
I think that localizing the story was very important. I think people wanted the big picture. They wanted to know, how safe the vaccines were, and where. But they also wanted to know, where can I get a test? Where can I get the vaccine? And so I think that we approached this story as consumers. What information do people need right now? And doing a lot of lists of, and links to websites and tips. in addition to like the research and the big picture story, a lot of local data, which we were able to get, first from sites, like Johns Hopkins put up a map that ended up being quite popular to get local data. The health department started putting up their own data, and so making it clear, where the risk was, as best we could in Maryland, where transmission rates higher, in central Maryland or in suburban Washington, Montgomery and Prince George's counties, which ended up having the most cases, obviously the highest populations, but also, Baltimore and Baltimore County. And then also local research that was done here was important. And how the government was responding and spending government money here, holding the leaders accountable for the tax dollars that they use to buy supplies, and which most of it was done on an emergency basis. So there wasn't a lot of the normal guardrails with bidding things out. So we made sure we kept an eye on that as well.
I want to take a moment to welcome our guest during this webinar. Thank you so much for being here, for connecting with us this afternoon. And we are receiving some questions. If you have any questions, please do so to our panelists. They are more than welcome to answer your questions. And we get one question from our audience is, how do you deal with misinformation? I think this question is a key because we receive so many information from so many resources all the time during the pandemic that we didn't, at some point, we didn't know what to believe, who to believe, and what to do. So Scott, can you please answer these questions, how we deal with misinformation more during this crisis?
Yeah, I think there's multiple factors in how to deal with this. One is to address it head on, to do a piece or an article particularly about a rumor that's going on. And, I wouldn't say that it's important to do this every time, right? You can't stomp out 1,000 fires, but if there is one where people are questioning, where do I get a vaccine? Something like that. These sorts of how-to guides are some of the best ways that people can go to a source and say, all right, this is how I know what to do. There's other situations, we had and still have politicians that put out many false claims. And I think it's important when quoting those politicians or people, when you have to quote them, to follow up with a fact check if it is a salacious claim, there's something that's not correct. Those would be the two, but I think it's also important to not further these narratives. The more that us as respectable media go forward and give credence to these, these misinformation, or, talk about it or try and stamp out that fire, it just adds more people wondering, what is that rumor? How, what does it mean? I'm going to look into it. So, I think we have to pick our battles in terms of what to stomp out, and just ensure that people get the right information first, and then to counter, information from people who are in authoritative positions when that misinformation comes up.
And Meredith, how you gather and verify resources and facts on a local level?
So I guess, having been a health reporter for many years before the pandemic happened, I had a lot of sources that I knew, would give me reliable information, or at least as up-to-date information as possible. Obviously, the story, evolved over time. And so I think it was important to, like Scott said, always fact check to the best of your ability, which was difficult, in some circumstances, because the guidance would change from CDC or from the local experts. But make that clear. This is what we know today. This is what we believe today to be true. Like, you're at low risk, but maybe tomorrow you won't be at low risk. Or, in the beginning, we were telling people not to wear masks, and looking back, could I have changed the way that I presented that information? I don't know. That was the information and the guidance that I had at the time from, Johns Hopkins experts, University of Maryland experts, local health departments, the normal authorities that I went to. So I think that that's just how you have to respond is make it very clear this is what we know today to be true.
We are getting more questions from our audience. Thank you so much for your questions, for being present and connected here with us today. And this is about HIPAA. I don't know who of you two can answer this, or you, both of you. Can you address HIPAA, laws navigating them?
Yeah, I'll start. HIPAA laws obviously make a journalist's job a lot harder. And for those who aren't familiar, HIPAA is a doctor and a patient's confidentiality in which they, won't release any sort of medical record to the public without prior consent. If you want to talk to someone or find someone who has a certain disease or is trying to get a certain type of drug, well, you can't just go on Google and figure that out. You need to find some sort of resource center. So if you're looking for sources in terms of, finding someone who has a particular type of cancer or something, there are many support groups or advocacy groups that I found have been helpful in reaching out to these types of people. In other situations, you have to find particular doctors and say, well, do you have any patients that would be interested in talking? In court cases, right now I'm covering the Archdiocese of Baltimore sexual assault cases. Many of these people don't want to be out in public. However, you talk to the lawyers and see if there are people who do feel comfortable talking about these sorts of situations. So you kind of have to go at it from a little bit of a side angle, but it's those laws are there for important reasons, and we definitely don't want to get in the way of important confidentiality.
Is there anything you want to add, Meredith, regarding HIPAA?
Yeah, I would say I agree with everything Scott said. I find, though, public officials sometimes hide behind HIPAA and say that they can't give us information, sort of broader information, public health information, like where cases were located. We ran into that a lot when we were covering COVID and other health outbreaks. They'll say, oh, an adult in Maryland has COVID, and we would say, well, what county? What were they an adult or a child? Were they a senior? Or did they have underlying health conditions? And sometimes they would tell us, they would sort of randomly say, oh, we can't tell you that because you'll be able to identify the person. And it was okay to push back. And so we did that frequently and said, no, that's not a HIPAA violation to tell us where, in the state. We just made sure we pushed back every time to get as much information as we could without identifying somebody's health condition without their consent.
And I would add to what Meredith is saying is just that it's important to know the law as a journalist, and if you're unfamiliar with it, brush up and know your rights from what if a public person is telling you that they can't give you information, well, double check, because you might actually be entitled to that information.
We have another question is, what is the best way for healthcare nonprofits to connect with journalists? What is your best advice, both of you? Meredith, we can start with you. My email and my phone number, I believe, are on the Baltimore Banner website, and we get all kinds of pitches. I wake up in the morning and there's, there could be 50 or 100 emails waiting for me. Sometimes I might not, I might skip over it. I might not read everyone as closely as I should. I think it's really important to put a strong subject line when you're emailing. And then if I don't respond, try again, email again. You're not bothering me. You got to get your information in front of me. So just keep trying, keep calling, keep emailing. And Scott, what is your best advice?
And I would agree with Meredith, and in continuing to try and reach out. I would say also cater your pitches to journalists if you can. And I think there's nothing more annoying than when you get a pitch from someone that's like, oh, do you want to hear about trees? And you're like, well, I'm a health reporter. This doesn't really. And look, I mean, yes, everything is about health in some way, but when people don't. When you can tell that it's just a buckshot sort of push out, we're less likely to look at it. But if you put time and effort into it, I think we're more likely to at least respond. And Meredith is correct. We get a ton of these pitches a lot. So it is hard to sift through at times. And we also want to make sure that it's not just a product that someone is selling, that these pitches are something that is helpful to the public, because that is our job, not to help create buzz around some sort of product.
So sometimes being persistent helps. If you send a press release information to your email, you make a phone call, probably follow up that, and trying to, push your idea could help as well. We're getting more questions, so this is very exciting. What aspects of health reporting that changes following the pandemic? Meredith.
I'm sorry, could you repeat that?
What aspects of health reporting changes following the pandemic?
What changes following the pandemic?
Aspects of health. Mm-hmm.
Aspects of health. Well, I think I'm not sure much changes. I think, we still try and report everything the same way we always did, looking for interesting stories. We're still going to be paying attention to the pandemic because it's still with us. I personally know many people right now have COVID, so I think we're going to be looking for stories on the pandemic going forward. But we're going to go back to covering more of broader aspects of health, going back to covering public health and research and stories of patients and sort of the gamut. I think we're sort of back to how we were before the pandemic. Taking pitches, coming up with ideas, and going from there.
Another question for you, Scott. Are you finding that local news is cutting back in specialty reporting?
Well, I think local news is taking a big hit in many different ways. Television news often now is focusing a lot on crime and what can get eyeballs on the television. And, there's not a lot of funding. I think we're very lucky here in Baltimore to have the Baltimore Banner, which has had, just amazing funding from an angel investor, and been able to really put extremely quality journalism out there. And they have a partnership with WYPR. And the work that they do, I think is very in-depth journalism. You don't get that in many other cities. If you go up to Providence, Rhode Island or something, you have one outlet, which is the Providence Journal. Here we have, I think public radio is always a great specialty media source in terms of finding at least a health reporter, an education reporter, something like that, at least in the big cities. But it is tough. And I know that there are some new grants going out from many of the, things like Kennedy Krieger Institute that are trying to help with local reporting and to keep it salient and to keep it alive. But, right now it is in dire straits.
I want to thank you, our participants. They are sending questions. Please, I want to encourage you to send more questions. This has been an amazing conversation with two top journalists. We are learning so much. This is another question. Can you discuss the importance of talking to source face to face rather than just over an email? What do you think, Meredith?
For sure. Yeah. I think during the pandemic, that was a real challenge, and where, Zoom and other platforms really helped us because we could still see people's faces. But being in there's really nothing that replaces being in the room with sources and seeing their environment, particularly going to their their places of work, or if you're going to the hospital, and seeing them interact with others around them. You just get more of a feel for the whatever it is that they're talking about. If you're going to Johns Hopkins, you can go into a lab and they can show you the equipment versus just talking to you on the phone. And there's something I guess disarming a little bit about being in the room with somebody and having a conversation. And certainly you can reproduce it a little bit on Zoom. It's a little harder in phone calls, but I think we all got a little more comfortable sort of talking in spaces like this, because we had to. We didn't have a choice for the last few years, but I've really been enjoying being able to go back out, being let back into doctors' offices and hospitals, and meeting people outside. And we even tried to do a little bit of that during the pandemic. We would go and we'd be like, well, we'll stand in your front yard, we'll stand back, and we'll kind of, try and have a conversation from, the 6 or 10 feet apart. But I really think that there's something lost if you're just communicating over email or text messages.
I want to add of what you're saying, Meredith, that also when you are out there covering a story for X topic, whatever it is, most of the times you get new ideas for another story. You talk to people, and I don't know if you disagree, but when you are out there face to face, sharing with people, you most of the times get another ideas, another stories, and that's fascinating. Scott, how important are uplifting community resources and activism efforts during a crisis?
Well, I mean, they can be extremely helpful for us as journalists, and I think they can be great resources for people within the community. I'm trying to think of some specific situations that I've gone through, but one of the things that I've covered a lot as a reporter in health is transgender healthcare, and there's many advocacy groups there who are not only important to the community. The one that I'm thinking of is Safe Haven, and they provide free haircuts outside of their advocacy headquarters, and have a very big community response and robust effort there. But they're also great in helping me connect with people who are transgender and need healthcare, or are using the healthcare resources that are available. These are advocacy groups that can be much like we were talking before about nonprofits and how they can be helpful in connecting you to the people that you need to get a hold of. These advocacy groups are the same way, but I would warn, they do have a message. They are an advocacy group, and so therefore you should take everything they say with a grain of salt, double check the other side of what they say, ensure that the people they've talked to have been properly vetted, or that you talk to, that they've connected you with, been properly vetted, and to give them the same objective view that you would really anything else. But I think that these organizations are always part of the state of play in journalism and are important factors. Everyone has a voice and wants a voice, but it just depends which ones you talk to as well. Absolutely.
Now that you mentioned a particular community, during the crisis like the pandemic, we always talk about diversity, that the crisis affect another community more than another one. So many issues about diversity that I want to ask Meredith, what measures are being taken to address the diversity and unique issues of the community?
Specifically with the pandemic?
The pandemic most, yes. During this crisis is where we talk more about this race and the other one, and how is disparities and all those things. So What is your opinion about that?
Right. Well, yeah, health disparities is a big issue. It's a big problem. It goes back, precedes the pandemic, certainly, and sometimes it's a matter of access to healthcare. Sometimes it's built-in structural barriers for some people, and I think that there's a lot of attention to that in healthcare now. It's certainly not over. The pandemic, I think, highlighted a lot of the issues that you can't just set up online, sign up for your vaccine, and everybody gets one, because some people, older people who were hit far harder, by the pandemic, may not be computer savvy and couldn't sign up for an appointment online. A lot of people didn't have transportation to get to a site. Specifically, the governor set up a site in Bowie, in Prince George's County, to get vaccines early in the, when vaccines were available, and said, look, this is a minority county, so African Americans will have access to shots, and they did not. When we looked at who was getting the shots at that site, it was a lot of people from Montgomery County and Howard County were coming and getting the shots. And so when we highlighted that, the state formed a task force to try and address access issues, and they made sure that they had mobile vans to go to neighborhoods, so people who wanted the vaccines could get the vaccines closer to home. And they also started training what they called ambassadors to go into communities. And these ambassadors were people from those communities, whether they were non-native English speakers or African Americans or seniors. And so when they went somewhere, they would stand out in front of a library or a school, and they looked like the community, and they sounded like the community, and they could answer questions, and that went a long way. And it was a lot more labor intensive, and you would maybe get a few shots, at a site a day instead of these mass sites where you would get hundreds, but it made things a lot more equitable around the state. But it took a while to sort of push that out and make sure that it was a little more fair.
Our participants are very engaged in this conversation. Thank you so much. We're getting more questions. And Scott, if you can answer these questions, what, if any, frustrations have you had covering health stories? For example, has anyone blocked you from reporting?
Yes, they have. Covering, going back to covering the military. I don't know if you've heard, but they're not really that fond of journalists over there. It's a pretty secretive place. So I actually spent about 2 years putting together a piece about really women in the military being harassed online by their peers, and the military did not want to respond to it, didn't want to talk about it, and so getting anyone to talk on their side about it was virtually impossible. And also getting people to talk in terms of who were in the military and experiencing this was also hard. They were afraid of putting their jobs in jeopardy, and also afraid of repercussions and retaliation. I think largely that's why it took 2 years to put together. And, to get around that, it took a lot of work on social media, talking to people on Twitter and just listening to and watching where these things happened, finding small advocacy groups and nonprofits that did work on this, and having them help me reach out to these people. And, I see it on the flip side of that is the awesome moment was seeing that article finally come out and help a lot of people, and get those voices amplified of people who were feeling really put down in the military and put in harm's way when they shouldn't have been and should have been treated as equals. So really fun article to do. It took a lot of work, and it was nice to get past those blockages, even though they were put in the way.
And this segues to our next question, which is pretty close what you just answered. And it's, what have been some of the most awesome moments you have experienced. So you have to share another story now, Scott, with us. But let's start with Meredith while you think about another awesome story that you have experienced. Meredith.
COVID related or un-COVID related?
Any, I would say any at this point, anything that really got in, into your career that affects you in a positive way, that it's been awesome.
Right. I would say the one of the more recent stories that I did that was non-COVID related was a mother called me and said that her baby was born with a disease that would make the baby grow increasingly weak, and over time the baby wouldn't be able to move, would become paralyzed, and would die very young. And there weren't very many treatments, but a new treatment had just been approved for this very specific disease, but it cost $2 million, and the insurance company had denied her claim. They wouldn't give the baby this $2 million cure. And so I started calling the insurance company and the lawmakers and everybody in to see who might be able to, convince the insurance company that to save this baby's life. And the insurance company changed its mind. And the day before we were going to put the story in the paper and said, yes, we'll pay. And they paid the baby. I watched the baby get an injection of this cure. And every few months after, the family would send me emails of the baby progressing normally, crawling and eventually walking. And it felt really nice to be able to highlight this case. And it was one of those cases where there were treatments that they did approve that were also very expensive. And over time, they might have ended up spending the same amount of money on this child that would have died as giving the baby the $2 million cure up front. And I think we're going to be running into that a lot more as these very expensive treatments get approved, and how the government particularly that pays for, I think Medicaid pays for 1 in 5 people in Maryland's healthcare, how they will respond to some of these types of treatments, like hepatitis comes to mind. You can cure hepatitis, hep C, but it's also very expensive, not quite $2 million. And a lot of people have it, so they can't quite give it to everybody at the same time. So they let you get a certain amount sick before they give it to you. That's how they've solved that one. So I think we're going to be seeing a lot more stories about costs of these ultra expensive disease cures and treatments.
But what were you able to do through your work? It's amazing. It's fulfilled, and it's part of our mission as journalists. Thank you for sharing that, Meredith. How about you, Scott? Any awesome story you want to share?
I'd really just say that I think it's pretty awesome almost every day, some of the stuff that I get to do. I mean, it's feeling the full emotional spectrum of being a human with other people is a really amazing experience. And so, sitting down with people who have been vindicated through the Attorney General's report about sexual assault in the Catholic Church, or talking to someone who is going to get their Parkinson's disease drugs filled with help through the Maryland Drug Affordability Board, talking to all these people and feeling the joy, the sadness, everything. Really is a privilege of being a journalist, and to tell those stories in the best way that we can, I think is just a really fun thing to do. And it's a great career to pursue, and definitely I applaud the people watching who want to continue doing it, because it can be tough at times, but it is really worth feeling that emotion, be it good or bad, because it does make you more human.
Absolutely. We have another question. Have you seen the health journalism field grow post-pandemic, Meredith?
The Baltimore Banner launched not quite a year ago, so that is something that has happened since the pandemic, and they hired 2 health journalists. I have a partner at the Banner covering local health news. So that's 2 more health reporters than we had before the pandemic. When I was at the Sun, when I started, there were, I think, a dozen health reporters. And over time, just like every other department at the Sun and at every other local newspaper around the country, you know, we lost health reporters, we lost city hall reporters, we lost state house reporters, cop reporters. It all got trimmed down, and I was the lone health reporter at the Sun. And then at times I had been on the business staff before I was on the health staff, and they would come to me and they would say, "We're short staffed. Can you help with these other stories?" And we always like to say we're all general assignment reporters. We all do everything. But I would really be taken off of health for extended periods, and we wouldn't have anybody paying attention to health. And so it's really gratifying that the Banner has come in and hired 2 of us to be committed to covering health coverage, and Scott's covering health coverage for YPR. And it's so I think maybe there has been a spotlight put on the need for health reporting. And I think that, I mean, you can see the attention to it goes up and down depending on, you know, like when there were bad points in the pandemic, we could see the analytics for our stories, and we'd see a lot more eyeballs on them when things were bad than when things are good. And so then that's the challenge for us to continue to make it relevant for readers.
How about you, Scott? How been your experiences? How easy or difficult is to just focus in one field as a journalist? How you seen this journalism in health grow, or what you can share with us based on your experience?
Yeah, I mean, I think finding a specialty, or at least a broad specialty, is extremely important. And if you are interested in health reporting, you know, I would say, take a class in microbiology if you're in college, if you have the ability, or to minor. Some people may not have the funds to do this, but, minor in something that has to do with health, public health policy or something like that, because you will get a good background. And even if you don't stay with it, mine was with government and politics, and got my master's in it. It still helps today, in the ways that I have to sift through a lot of, public notices and legislation. It's extremely helpful having that background. I know that the University of Southern California has many internship and mentorship programs through health and science. And they also have I believe it's called the Open Notebook newsletter that people can apply or can subscribe to, and just kind of read what's going on in the world of science and health journalism. But I think I have seen definitely an increase in terms of job descriptions and job, not applications, but job openings or creation of health journalism jobs. And I think that is part of, because of COVID-19, people realize that health is now going to be a huge issue. And it does, as I said earlier, touch everything. It has to do with poverty and environment and really everything that we do. So, I believe I saw a couple, specific like COVID journalists back during the pandemic as well. So I think, newspapers and media outlets are realizing that this is something that is not going to go away fully, and that health is going to be on the rise in terms of the amount of stories that are going to be of interest.
Scott gave us an amazing advice. What is your advice, Meredith, for those who wants to pursue their career but focus in health journalism?
Right. I agree. If you can take some science classes and some health classes, that's helpful. There are some even degrees that you can get in science writing, which could be helpful. I got a journalism degree and a double major in journalism and government also. And I was a government reporter for a long time, and I was a business reporter for a long time. And I would say both of those things were extremely helpful in switching over to cover health. With business, you know, covering the economy and really learning how things get paid for, and then covering government, understanding how they fund you know, public health and fund, you know, what kind of share of the budget health is or isn't increasingly. So I would say covering just about anything is helpful. And also just if you can get to some place where you're assigned to cover something else, you can still, everything overlaps, like Scott was explaining. Figure out, you know, environmental health or the business of health or any aspect that touches on health, because it's such a broad category. And just, you know, and if possible, attach yourself to somebody who is covering health and see if you might tag along, or certainly, you know, get an internship, and just sort of make your interests known, and just look for the stories and pitch stories, either as freelance or you know, as a writer somewhere. But certainly there's a lot of opportunity to write a lot of different kinds of health stories. Keep your mind open to what is a health story.
We have another question from our audience, and is, can you talk about the importance of finding personal stories to illustrate a new study medical breakthroughs as opposed to just report results? We can.
Yeah, I'll jump into that. I think it's extremely important, you know, to just tell someone that they, you know, you might get a cough during COVID, is something that it doesn't really illustrate what exactly is going on. You know, if you can talk to someone who said, you know, the back of my throat hurt, I'm wheezing right now, you know, this is the wide range of symptoms that you may have. I don't know if anyone's ever been, I'm sure everyone here has been on WebMD, and it says, well, your symptoms may include this, this, and this. Well, they're so broad. You don't really know what it feels like to have numb toes or, you know, whatever that people have during COVID. And we're seeing this, you know, with long COVID, that we're having many people illustrate what the broad range of these symptoms are. And then outside of that, it's just so important to bring a human just voice in to explain something. I mean, numbers and you know, studies are just so abstract and boring and dry, and your audience is going to lose you in 0.3 seconds if you don't bring in some sort of, you know, natural story to this. You know, humans are storytellers, and we want a thread, a narrative thread to follow, and that's really the best way to do it.
And I would say also people can see themselves through their stories. They say, oh, this person looks like me, my family, and that can happen to me. I think that's an amazing way to connect to stories, is through personal stories that we can share with our audience. We have another question for Meredith. Any tips or best practices for reading and comprehending dense report studies? For example, even the COVID dashboard is so complicated, and I agree. Trying to read those numbers and races and percentages is not easy. So what do you think, Meredith?
Right. Yeah, I agree. I think that I would always try and go through research reports or the dashboards, looking for one specific number. If you can focus in on one very big or shocking or important number when you're writing, and then you can sort of drop in other you know, information lower. I think breaking things down into very small digestible parts is really important, and I try and not use the jargon as best I can in writing, or if I do feel like I need to use a term, and I think we all learned a whole bunch of new terms during the pandemic, to put a clause in there explaining what the term is, to always, not assume anybody knows what you're talking about or what this word means that's new in our vocabulary. But I also try and write in the most conversational way that I can. So when I go through that dashboard and it says that a certain number of people are in the hospital. Like I think I looked yesterday and there were 79 people in the hospital in Maryland with COVID right now. Well, is that a lot? So you need a context. So at the height of the pandemic, there were 3,000 people in the hospital at any given point. So 79 is quite low, but you also don't want to make it seem like 79 is still, that's still a lot of people. So I think we also need to, in addition to the context of like how big or how small, not forget that they aren't just numbers, they're representing people as well. And so that's, dozens and dozens of people that are still very, very sick from COVID. So I think, stopping and reminding yourself of the scope and that context, and writing with that clarity and that not breeziness, but conversationally read it out loud to yourself and see if it makes any sense to you, and if there's anything that you need to explain further.
And Scott, how important is knowing your community?
Oh, extremely important. I mean, if you don't know your community, then you don't really have an opportunity to come up with stories, to meet people who can help you come up with better stories, to hear back from how you're doing. Some of the ways that I try to engage is one, just try and get out around my neighborhood in Baltimore and see what's going on. I happen to live kind of in the center of the city, and so I'm looking and seeing, well, there's a lot of abandoned houses over here. There's a lot of people outside of this clinic, this free clinic. Just ways in that you see your own community is very helpful in that. Other ways are just checking in with people. I try to check in with places like the Rural Health Association for Maryland, that Maryland Hospital Association, patient advocates, and also places like the Alzheimer's Association. What's going on? What are your people thinking about, so that I can be engaged with you, and I may not be writing an article, but we can create a dialogue, and down the road, eventually it may turn into something. You may say, well, I have 2 people on this drug now, and then the next week it's 12, and then it's 25, and then, well, now you have a trend. So I think the community is really all you have as a journalist. Otherwise, you're just writing into a black hole. So be engaged as you can.
It's good, but sometimes getting into the community is not easy for a journalist. I don't know if that happens to you both, but sometimes when you present yourself as a journalist, people are scared. I don't want to be on camera. I don't want you to come too close to me. I don't want to tell my story. How you make that connection, how you make them trust you and tell the story and come to you. I don't know if that happens to you, but sometimes when they see you with cameras, people run away. Or when you approach to someone, oh no, I don't, sometimes it's that barrier. So how you come to them?
Yeah, microphones, being in radio, microphones are very scary. And I'm sure you've done TV work, so it's even scarier. One of the ways I think is you have to be engaged with people and kind of talk to them without the wall of this microphone. So get to know someone first and tell them a joke, tell them, you like their shirt, make some sort of rapport with this person. Kids are often the hardest because they want to hide behind their mom or, whatever. And so you can say, do you want to see how this microphone works? Like, look, it's connected to here. And adults are the same way. It's just we need a little more complex and abstract ways of doing it. So, talking about what was on TV this week or anything, just to kind of get an engagement so that they know you're not a big scary person that's trying to screw them over, really. And then afterward, after you've kind of made this rapport, say, it would be really great if you could just tell me that, what we just said after you start talking about the topic you want to talk about. If you just said it for the tape, I'm not going to try and change anything you said. It'd be really, a lot of people would love to hear what you have to say about this. So if you just say it in here, and I'm going to take out the ums and ers, I'm going to make sure that you sound great in this. So you want to give it a shot? And then, it's up to them. But you just kind of have to show that you're not, a big, scary journalist, that you're a human too.
I like that. Now, I'm sure no one was prepared for the COVID-19 pandemic, not even as journalists. Nobody was prepared when nobody knew what was coming. Now, Meredith, how would you approach a future global health crisis? Would you do something different?
I'm not sure. I've thought about that a lot, if I would do anything differently. I went through the H1N1, I guess it was a pandemic, much, much smaller, in 2009. So I sort of had a practice run. I've had these stretches where I've only written about one thing, like the Affordable Care Act, I've covered every flu season. This obviously, is such a magnitude, greater than anything that any of us have ever covered. But looking back, I think that I did the best I could every time. I mean, obviously, we would like to have known more in the beginning than we did. But I think we have to just go in and approach it. What do people need to know today? The very, very important information. How do we present it in, Q&A form, or, long stories, all those real people that were affected by it? How do we tell their stories? I think that we, as journalists, did a pretty good job over the course of this pandemic. Obviously, there was a lot of misinformation out there that somehow we didn't manage to stop. But I'm not sure how we could have done that looking back. So I think that the lesson is, maybe is for society sort of generally to continue to invest in public health, and we need to keep the spotlight on it, the importance of keeping that infrastructure ready, because there will be more viruses. Maybe this one will keep mutating and we'll keep having to deal with it, or there'll be something down the road. So we as a society need to be prepared for the next one.
We just have a couple of minutes left for this conversation. It's been amazing talking to both of you. I want to thank all our participants for all the amazing questions as well. And your advice, Scott. Let's close with that. I think we got an amazing advice and experience about Meredith's experience, but would you do something different? What you can say and advise probably our future journalists that want to cover health in particular?
Yeah, I mean, in terms of a pandemic, I think it would depend on how the disease presents itself, right? This was an airborne disease, but the amount of contagion, how it's contaminating other people, it's almost impossible to tell, right? But we did learn a lot about things like supply chains and manufacturers from the business side of things, in terms of how to protect ourselves and how ready they were, and how much stimulus they needed in terms of getting the gear and things that we needed. So, that I think would be a really interesting place. We saw a lot of surprises there in terms of protective gear and being able to get that for people. Where are the bottlenecks in finding out how to make our life safe and as best as we can make it? And then also looking at communities that tend to be hidden from regular view. How are people in poverty faring? How are minority groups faring? How are people who are immunocompromised faring? Because, often those people get overlooked. And I think that that is an extremely important part of the puzzle that may have been overlooked in the beginning of COVID, and then later on got a good amount of coverage.
Meredith Cohn, and Scott Maucione. Thank you so much for this conversation. Thank you so much for being here with us today. Lessons learned from COVID-19 media coverage. This webinar is supported by the Healthcare Initiative Foundation. If you like it, well, there's more. There's another webinar coming up. That webinar is coming Thursday, June 1st from 5:30 to 6:30, and it's gonna be about health equity reporting. That is the topic. So I wanna thank you for being here. Top journalists, thank you so much for sharing your experiences with us today. And for all of you, all the participants, thank you so much as well. My name is Andrea Sarralde from Montgomery Community Media. Thank you so much. Until next time.